Good morning, everyone. Our topic that was assigned to me is all about glioma in pediatrics. So, today we will be talking about the definition of glioma and also the risk factor, the management, the um, related factors that causes or that triggers the occurrence of the related disease. And we will be talking also for the symptoms, signs, nursing interventions, and medical management regarding glioma. I will just going to reiterate what is glioma or what are the key points that we will be tackling in this topic. Childhood brain stem glioma is a disease in which non-cancer or malignant cancer cells form in tissues of the brain stem. So, this glioma can be identified as a malignant or a non-cancerous, or either it is a tumor that can be benign or malignant. In this glioma, there are two types of brainstem gliomas in children. The cause of most children brain tumors is not yet identified, so meaning the main causes of this disease or the occurrence of this disease is unknown yet. No further study about the occurrence of disease found at this present time. So the signs and symptoms of brainstem glioma are not the same in every child. So in here in glioma, we will also tackling about the different tests that the patient will undergo uh, to further examine the tumor that has been found out in the brainstem glioma. So we will be encountering also what is biopsy, or the biopsy or is a procedure that may be done to diagnose certain types of brain glioma, and also the certain factors affecting the prognosis and chances of recovery regarding this glioma. We're now going to proceed on the definition of glioma. So what is glioma? Glioma are tumors formed from the glial cell. Glial cells in the brain hold nerve cells in place, bring food and oxygen to nerve cells, and help protect nerve cells from disease, such as infection. In brainstem glioma, glial cells in the brainstem are affected. So, in the occurrence of this, what we call glioma, the glial cells are being affected. Since we know that the function of glial cells are holding the cells in place, bringing food and oxygen to the nerve cells, and also protect the nerve cells from getting infected or from being developing a disease such as infection. So that is the definition of glioma. But in children, we have two types of glioma. We have the DIPG or the DIPG, and we have also the focal brainstem glioma. And the first type of glioma, we have the DIPG. It is a fast-growing tumor that forms in the pons. DIPG is hard to treat and has a poor prognosis. It is not a well-defined tumor and spreads among the healthy cells in the brainstem. Vital functions such as breathing, heart rate may be affected. So in the first type of glioma, it has a very poor prognosis. It means that difficult or a lower chances of living, and the tumor also has a possibility to metastasize on the other stem cells in the brain, and it can be spread from one stem cells to another stem cells, and all the vital functions can also be affected, such as breathing, heart rate, and maybe the heart uh, rhythm or the pattern of the heart. That is the first type of glioma. And we have the second type of glioma. We have the focal brainstem glioma. A focal glioma is slowing growing tumor that form outside the pons and in only one area of the brain. It is easier to treat and has better prognosis than the IPG. So, a while back, I defined the IPG that the tumor is being grown inside the pons. But this focal brainstem glioma, the tumor forms outside the pons and it only one area of the brain stem. So it affects only one area, meaning the tumor is localized. It doesn't spread to the other stem cells of the brain, but it just stays on the one area or one place of the stem cells or the brain stem, and it is easier to treat and better prognosis than the IPG. The cause of most child brain tumors is unknown, meaning that the occurrence of glioma is not yet identified what is the real reason behind. But we have these possible risk factors that may triggers the occurrence of glioma. We have the having certain genetic disorder such as neurofibromatosis type 1. So that is included as possible risk factors that children will having the possibility to develop glioma. Let's proceed to the signs of symptoms that the patients are experiencing during these stages. So we have trouble with eye movement. In trouble with eye movement, the eye may turn outwards or inwards. We have also vision problems. We will be experiencing eyesight problems, morning headache or headache that goes away after vomiting. So mostly of the patients are experiencing morning headache, but this morning headache will goes away once the patients vomit. And we have also nausea and vomiting. We will be also experiencing unusual sleepiness, loss of ability to move one side of the face. Still in the signs and symptoms, we have also loss of balance and trouble in walking. So we will be experiencing struggles or problems in walking and balance. More or less energy than usual. In usual activity, we will be experiencing more or less energy. We'll also have changes in behavior, trouble learning and school. So what are the medical managements or the tests that will be performed to further diagnose or to further study the occurrence of the disease? We have the tests to be done. First one is the physical exam. So in physical exam, the doctor or the nurses in the hospital will going to examine or perform or do physical assessments on suspicious or unusual things to be seen in the brain or on the head. So such as lumps, masses, or other suspicious things to be seen in the client. We have also what we call the neurological exam. It is a series of questions and tests to check the brain, spinal cord, and nerve function. This checks a person's mental status, coordination, and ability to walk normally, and how well muscles, sense, and reflexes work. So in neurological exam, it checks the mental processes or the mental aspect of the client or the mental status or how the ability or the mental functions coordinates to each other, the mental muscles or also the reflexes, tendons, and other senses. Management is the MRI, which stands for magnetic resonance imaging, a procedure that uses magnet radio waves and computer to make a series of detailed pictures of area inside the brain. So in magnetic resonance imaging, this uses a radio waves or a magnet that detailed or pictured or view a specific area of the brain to further analyze or to further study the stage of the tumor. So that's all I think in the glioma. Thank you so much for listening.